topics. Even the layman can understand this topic. I planned like this. The first part will be, am I audible to everyone? Yes. The first part will be, I will be talking about pain. What is pain? How we perceive pain, how the science perceives pain. That I'll be talking. That will be around for 15 to 20 minutes. Then second part will be the brief history of hypnosis and the hypnosis. I will dissect the hypnosis into different parts. Maybe some of the people may be hypnotists also. For the benefit of common man, I will give in detail about hypnosis, how the modern science views about hypnosis. It's not something quackery or something like that. It's more about purely science. Even American Psychology Association approved this type of treatment. And the third session will be the pain hypnosis for pain management, a demo. This is my aim. In all the topics, I have added latest information to the extent possible. And if I ask one question, have you ever experienced the hypnosis? Some people might say, no, you cannot hypnotize me. Some people might say, no, it's very dangerous. My point is, you are being hypnotized every day. Every day you are being hypnotized. Have you ever seen a movie, beautiful movie, and you are totally absorbed into that? While watching movie, you cannot listen anything away from the movie. Have you ever read a book completely absorbed? You are listening to beautiful music and so engrossed. So then you have experienced hypnosis too. So I will talk about this in the later part. So I would like to share my screen. Can you allow me to share my screen?
Suresh, can you give host option?
Yes, you can give.
Yes, sir.
Host disabled sharing option.
Yeah, just a minute.
Sure, sir, please.
Done.
Okay.
Please check.
Yes, it's okay.
Ma'am, can you just?
Yes. So this is hypnosis, self-hypnosis for pain management. It's not working.
Good evening.
Good evening. I owe my deep gratitude to my teacher, Sumati ma'am. Namaskaram, Sumati ma'am.
I'm sorry, I'm a little late. I had a client, so I had to finish it.
Okay, ma'am. So the first part will be the understanding about the pain, and the second part will be the science of hypnosis, and the third part will be the hypnosis for pain management. Do you have pain? 1 minute.
On and off.
Yes, okay. Do you have the pain or know someone who does? Then you are not alone. Between 70 to 80% of the people have pain at some point. 70% of people, 90% of people headache. And 10 to 20% of the people have chronic headache. Low back pain, 70% or 80% of the people at one point of time. And 30% of the people, low back pain, they have at least once in their lifetime. The pain, we can say there is a nerve damage is there, and it is common for all the diabetic people also. So chronic pain can also result from having disabilities such as spinal cord injury, multiple sclerosis, acquired amputation, and muscular dystrophy. Chronic pain can emerge from after surgery also as a side effect to medical treatment such as chemotherapy also. So what happens when you have the pain? Pain interferes with all aspects of life. You cannot sleep properly. You cannot stay asleep properly. Your ability to work gets reduced. You cannot engage in your favorite hobby. You cannot enjoy anything. And before pain and after pain, you'll be totally different person. Often you'll be moody, irritable, helpless, hopeless. So when you have the pain, you cannot move here and there. You will avoid walking. You will avoid all the work. Naturally, you will gain weight. And when you gain weight, it is a burden to your ligament, and it is again giving you more pain. So is there any cure for pain? No, you can build a satellite for communication, but you cannot find cure for pain, because nerve cells transmit signals from damaged part to brain. So you need to find the drug to slow down this process, the pain message. Unfortunately, it is not so easy. Surgery to treat pain is also will make you worse. It is ineffective. And we have been telling that painkillers, there is no such thing as painkillers. Even the most powerful analgesics like opioids decrease the pain intensity only by 30%. Then what happens? You will have the tolerance to drugs. And when you have the tolerance, over the time people build resistance to drugs, and which include, they will develop side effects like nausea, constipation, sleepiness, difficulty in breathing, and the lack of movement flares up. So here the objective is learn self-hypnosis and or hypnosis, use of hypnosis to manage your pain. It's not eliminating pain, it's managing your pain. The difference between hypnosis and self-hypnosis is hypnosis you receive from a clinician, which is scientifically tested, and you are going to learn some of the skills for pain management. And you can record this entire hypnosis session, and you can listen to whenever you want. Then what is pain? Many people thought that brain is the passive recipient of sensory information. That means a TV without remote control. Whatever the TV station people are sending that broadcast, you will be listening. But actually, your brain is a fully functional artificial intelligence smart TV. It has a volume control and channel changing knob. That means you can change the channel, you can control the volume, and your brain is like a fully functional TV, and you can decide which channel you want to watch, whether pain channel or discovery channel, which channel you want to watch, you can decide. Brain has a volume control knob too, and volume changing, channel changing knob too. So you can learn how to use this using hypnosis. Pain is not only the damage, pain is the end result of various activities from the different parts of the body and also brain. You can learn to control that also. We will see the history of pain. In 1600, René Descartes, he said, a French philosopher, he argued that it's a simple reflexive response to bodily injury. If you stuck with a rock, there is a small rock means you will get a small amount of pain. If it's a big rock, you will have a big pain. But it is not answering some of the questions like it was accepted until 1960, but it does not explain how two different people experience different amount of pain with the same amount of damage. And you might have heard that even athletes run when the legs are broken. So there is no answer given for this. Then came the 1960s, came the gate control theory called in 1960s, Patrick Wall and Ronald Melzack. They proposed this gate control theory. So they found that the pain information going through the brain is modified when it is entered into the spinal cord. There is a gate at the spinal cord which can amplify or turn down the volume of the pain. This is called gate control theory. Brain has control over that. The gate lets more information on pain into spinal cord when you are worried, anxious about the pain. The gate is closed. When your thoughts are not focused on pain, and you can change your thoughts and feel less pain. That is the key point of this hypnosis. And where are the locations that you can feel the pain? The first one is skin, bones, muscles, and periphery. Skin, bones, and muscles and periphery, everything together, we can call it as a periphery, respond to physical injury. They contain sensors and they send information to the spinal cord. This is called periphery because it is outside the brain. We have nerve fibers. We need not bother about the nerve fibers because yes, we have thin C fibers and the A delta fibers. All these things, they transmit the pain. Next comes the spinal cord. See, here is the structure and all the pain causing items are located in a particular part of brain, very nearer. They talk to each other. The next comes the spinal cord. Brain decides the sensation of the pain. It can open or close the gate. Athletes tend to close the gate to pain message. Next comes the thalamus, located at the right in the center of your brain. It sends signals from the spinal cord to different parts of the brain. It's a relay center. So what are the different parts? The first one is the primary and secondary sensor cortices. The second is insula. Third one is anterior cingulate cortex. And fourth one is prefrontal cortex. First one is the primary sensory cortex. Sensory cortex tells where we feel the pain, whether it is in head or foot or hand. It can tell, but how the sensation feels, whether it is burning or cold or sharp or dull or none. But no information is given how the upsetting pain is. And no information on how to stop the pain also. Next comes the anterior cingulate cortex. It lies between two parts of the hemisphere, but it gives the emotional response to our sensation. That means when you are upset with our pain, it calms down. When you are not bothered about pain, it is become active. Next comes the insula. Lies deeply inside the fold of the brain, the sensory cortex. It monitors and evaluates your body health. When something is wrong, immediately it gives the signal. It is active when physically we are wrong. Suppose we are in need of oxygen or any food or any physical damage, it becomes immediately active. So next comes prefrontal cortex. It is the front surface of the brain and it processes the memories of the pain and conclude the meaning of the pain. There we make decisions and coping strategies. More activity of the prefrontal cortex and less pain. Next comes the overall brain activity. Pain is the result of the overall activity of the brain. You imagine that different parts of the different people are talking in a room. Just like that, the brain is talking to each other. Different parts of the brain is talking. And we need to learn how to calm down the brain. When the brain is calm, there will be decrease in pain. That's the thing. And your thoughts also influence the pain. The thoughts or the words that go through your mind, good or bad, it is determined by your thoughts. Thoughts about pain will influence how the intense the pain is and how it makes you feel. So some of the helpful thoughts, if you think that I can control my pain, you need to think that you have the skills and abilities, resources that you can influence the amount of pain. I can get on with my life, whatever it comes, I can live consistently. These are the helpful thoughts. And unhelpful thoughts, my pain is catastrophe. I am disabled. Pain is a signal of harm. Some doctor somewhere knows about my medical cure for the pain. Medications are good ways to manage the pain. And everybody should come to me and they should take care of me when I am hurt. These are the unhelpful thoughts. And we have the coping strategies. Coping strategies also decide how much pain you feel. And there are two things, resting and guarding. Resting means less pain in the short term and more pain in the long run. There will be a short-term decrease and long-term increase. Resting and analgesics are good only for the short term. Excessive rest is also not good for body. Actually, resting does not cure chronic muscle spasms. So, and helpful response for coping. You should have coping self-statements. You should have good self-talk. And you should maintain appropriate level of your activity. And you need to be allowing the activity that will not interfere your activities. You need to have a minimum exercise and stretch. You need to seek the social support. You can talk to your beloved ones. The unhelpful coping strategy is resting, guarding, asking assistance. So up to this is I want to tell about the pain strategies. That means everything decided by you. And if you have any doubts up to this, you can ask.
Guna,
Yes, ma'am.
can I ask a question?
Yes, ma'am.
I'm aware of all these and I am struggling with my pain as of now. And I'm able to understand and relate to everything you're saying. And
Yeah.
yet we get caught into the unhelpful thoughts because of suggestions given by medical community. And so there is a confusion. There is on the one hand, there is one school of thought saying the body will heal itself. You need to think positive and take care. And another part saying in the long run, that's not going to help. So that conflict actually creates a lot of stress. In managing pain, while I'm aware of all these and I've been managing all along for so many years, I'm now at the tipping point. So I'm wondering, like, can you just go for a couple of things like guarding? What is guarding there?
Guarding means you are not using that part. You are
So
not
then-
using that. When you have the leg pain, you will not use that part.
Yeah, I'm very surprised that you never use the word knee pain anywhere in your
No, it's pain means it's everywhere. Pain means everything.
So
There's
then,
no-
I'm able to understand and relate to the pain, the mind part of the pain.
Yes,
How
yes,
the mind
yes.
plays a role.
Yes, yes, yes.
How do we distract the mind from the pain when there is a pain?
That's with that we are going to talk a little bit
Okay.
later.
I'll
And,
wait. I'll wait.
yes, ma'am. Okay, any more questions?
Yeah,
No,
just
no,
adding
no.
to what Sumati said, the mind part of the pain, maybe through hypnosis, we can reduce. Say, like a physiology, say if I have a toothache, I may have a headache.
Yes.
How is it through hypnosis? We can work on that also. Physiologically, there is some issue there. Through hypnosis, can it be managed?
Pardon, I'm not getting you, sir.
See, Sumati was talking about mind and pain, mind
Yes,
related.
yes,
It's
yes,
just psychological pain, like a stress when we are stressed or something like that.
yes,
So to that extent, I can understand, like through hypnosis, it will be helpful to manage that pain.
yes,
If there is some physiological problem, like to take or like say I fall down and there is a fracture,
yes,
my bone has broken. Can
yes.
hypnosis help to deal such situations also?
No. For I would like to give one simple example. You might have, madam,
Sumat,
your mic is
you're
on.
muted, Sumat. Yeah.
Before you go to the example, Surya, I meant physical condition where I'm having the physical cause for the pain, and that is my question. How do we then distract the mind? It is not just about that pain also is psychological. That is what Guna is explaining. Am I right?
Yes, ma'am. Yes, ma'am.
Okay.
Okay, I will talk about. I will answer this in due course. And up to this, if you have any doubts, we can talk about this.
I was just looking at, you said among the unhelpful activities,
Yes, sir.
asking for help.
Yes.
But see, I ask for help in terms of getting information, not necessarily in case of dependency.
No, that is there all the time. People will be so I am painful. Why don't you help me? I am all the time. They will be complaining. There is a clear difference between asking help and complaining.
Okay.
All the time they will be talking about only pain. Whoever comes, they will talk about only pain.
Good evening, sir.
Good
So,
evening.
in one of the slides, you said that the pain sends a message, sir. Can you just elaborate a little bit on that?
Yes, for example, one minute. Yes, you have a broken part, some injury. Immediately, the peripheral nerves, there are a lot of nerve fibers like thin C fibers, A, thick A, delta fibers, sends the information. And that information goes to your spinal cord. And from the spinal cord, it goes to the brain, and it is sensed by different parts like primary sensory cortex, thalamus, then anterior cingulate cortex. And all these people, they talk together and decide, yeah, we have received some pain. We are getting some meaning. They are giving the meaning. When all the people talk together, that means all these parts, primary somatic sensory cortex, insula, they decide, yes, I have the pain. And the quality of the pain decides by these four parts.
Okay, sir. Thank you, sir.
Welcome. So, if there are any questions?
Good evening, sir.
Good evening.
Sir, you said something about guarding. Will you please repeat it, sir?
Guarding means you have a leg pain.
Okay.
You will not use legs often.
Okay.
It will be all the time resting only. You have the leg pain, you will not go for walking.
Okay.
That is guarding.
Okay, sir. Okay.
Yes.
Okay, sir. Thank you.
Okay, fine. So let us talk about hypnosis in brief and a brief history of hypnosis and the different parts of hypnosis. Then we'll go to actual induction process. Hypnosis is a procedure in which one person, the subject is guided by another person, the hypnotist, to respond to suggestions for changes in the subjective experience, alteration in perception, sensation, emotion, thought, or behavior. Normally, hypnosis is offered by the clinician. Then what is self-hypnosis? You can record those events, or you can use his or her own abilities to experience the hypnotic trance and feel the benefit of on his own. This is outside the clinician. You can make recording of your sessions and listen to these recordings. This is the difference between self-hypnosis and hypnosis. And what is the process of different parts of hypnosis? First one is induction. The induction is making the subject to focus attention on a single object or sensation or image, or followed by some suggestions for making some positive changes. Next comes, we will talk about this in detail in the next few minutes. We will talk about brief history of some hypnosis. Brief history of hypnosis, and we have been telling this hypnosis all through the history. Ancient Greeks, they used, Egyptians used the dream temples or sleep temples, where hypnotic suggestions used to treat the symptoms. And modern scientific history starts with Anton Mesmer in 1734 to 1815. Mesmer was a physician and practicing in Paris in the late 1700s. He believed that bodily tissues held magnetic energy, and this energy could be directed using magnets to ease the symptoms and to heal the disease. He believed that some people had more magnetic energy, they named it as animal magnetism. Mesmer treatments were so effective and became so popular, so the King Louis XVI appointed a commission, which included Benjamin Franklin, and found that Mesmer was incorrect and concluded that this is possible due to imagination. And Mesmer himself was discredited and left Paris. In the 1800s, Mesmerism translated into English and published in UK. James S. Dale used hypnosis as anesthesia for surgery from Calcutta. During that time, chloroform ether was discovered. The Mesmerism came to be called as hypnosis in 1840. Next comes Jean Charcot. As a French physician, he believed that hypnosis could be used to induce and study various neurological conditions. And we have a lot of history on Jean Charcot, and we know about Sigmund Freud. And Sigmund Freud visited Charcot to learn more about hypnosis and its clinical implication. He began using hypnosis, but he developed his own theory of unconscious mind. After that, we have this Clark Hull. He published a book and that he presented the result of highly controlled experiments using hypnosis. And of course, everyone knows about Milton Erickson, a practicing psychiatrist, published the results of creative use of hypnosis and hypnotic body language to help the patients manage a variety of symptoms and problems. Next comes the Ernest Elgod, and a professor of psychology at Stanford University, designed laboratory for conducting experiments of hypnosis and hypnotic analgesia. His model of hypnosis is one of the prominent theories even today. And the modern theory, as an Aladdin, the cognitive is very developed cognitive behavior therapy and hypnotherapy together, and he formed a lot of formulations for cognitive behavior hypnotherapy. And the recent one, Michael Yapko, and he has done fantastic work in hypnosis, and he has this is purely approved by American Psychiatric Association. And there are a lot of myths about it. And this Mr. Mark P. Jensen, recently I met him. He is from University of Washington. He has done a lot of work on pain management. And most of the works I'll be sharing with you is only from Mark P. Jensen. And a lot of theories are there about hypnosis, dissociation theory, socio-cognitive theory views, and neurophysiological views. We will talk about one or two theories. Neurophysiologists discovered that brain activity in people who respond to hypnosis. They have used the MRI scan, fMRI, EEG, ECG, whatever you call it. They found that hypnosis has a measurable effect on brain. Hypnosis has a measurable effect on pain, anterior cingulate cortex and prefrontal cortex, and this insula. On all these things, hypnosis has got a measurable effect. They found that the overall electrical activity has decreased, and hypnosis calms your brain. It processes less information on pain. That is the key finding. Effect of hypnosis on pain, if you talk about the different parts, that is brain areas, hypnosis can alter the information to process the pain information. The periphery, hypnosis also influences the levels of chemicals in the skin. Sensors less sensitive to stimulation. And nerve and spine, hypnosis can influence nervous system and decrease the pain response to stimulation. The overall brain activity, you can calm down. And this they have measured through PET scans, fMRI, and EEG. And you may ask, some people are highly hypnotizable, some people are not. And no matter the ability to respond to hypnotic suggestions, high or low, it has got a small difference, because all the time you are talking to your brain, you are talking to the other person's brain, and they listen to that, and it is getting registered. Is there any side effects on hypnosis? Yes, we have side effects, but it is overwhelmingly positive only. So hypnosis has a significant and meaningful reduction in pain in hypnosis, and pain intensity also reduced during individual sessions. There are a lot of misconceptions about hypnosis, that is hypnosis versus sleep. The hypnosis, we have still conscious, and during sleep we are not conscious, and control over the subject. Still the subject can, if they don't want, they can come out. They are highly suggestible. Yes, they are highly suggestible, but if it is against their moral, they can come out. Loss of consciousness is not there in the hypnosis. You can remember everything when you during the hypnosis, and there is a clear difference between clinical hypnosis and staged hypnosis. And hypnotic, in the sessions, you will have normally hypnotic inductions, then you will have the suggestion, you will have the reorientation, and in this session I have included the age progression and the final induction. Induction, the final, the closing one is the induction. Normally, how many sessions we can have? 4 to 10 sessions, minimum 4. How often? Any number of times, whenever time permits. Self-hypnosis you can do, and for hypnosis, clinician will do evaluation. For example, you can have not necessarily you need not have the entire 20 minutes, 30 minutes session. Even you can have every day you can have 5 minutes, 10 minutes suggestions or hypnotic sessions. That is also very fine. What is hypnotic induction? The first part of hypnosis is hypnotic induction. Hypnotic induction helps you to enter the hypnotic state. And the pre-induction, we will be doing something, take a deep breath, hold it and let it go. It is the invitation to focus your awareness and attention on a single experience. And it can actually slow down your brain activity. Your entire body will be relaxed, and you can have suggestions for deepening the experience. And there are hundreds and hundreds of induction methods available, and now we deal with 2 or 3. And countdown relaxation, you might be knowing, many people might be knowing that you have to start from the 10, like in an elevator, you are traveling in an elevator, 10, 9, going deeper, deeper, deeper. And relaxation induction, that means JPMR, Jacobson Progressive Muscle Relaxation. And today we'll be using the safe place induction. This is another method, induction, that we will be using it. Next comes the suggestions. What type of suggestions you can make? Clinician offers suggestion and the brain will respond. The suggestion should be appropriate to your comfort and well-being. You can make your own suggestions. You can formulate your own suggestions. your suggestions for change in the sensation, feeling, moods, thoughts, and behavior. It is purely based on treatment goals. Suppose if you are doing hypnosis for sleep, fatigue management, the entire thing will change. So you can, for the decreased pain or impact or healing, comforting, you can give suggestions and naturally it will close, you can close your gate of the spinal cord. And after that, hypnotic suggestions, you need to give the post-hypnotic suggestions so that you can travel with benefit during the hypnosis. What are the benefits you obtained? You can travel even after the hypnotic suggestion, the effect that would last beyond the session. So the suggestions for whenever the client wants the hypnotic state, that also you can include in the hypnotic post-hypnotic suggestion. You can give some behavioral cues. So whenever you breathe, you will be more relaxed, like that you can give. And reorientation, or you can say in modern terms, it is modern sciences reorientation. The previous they say end action, induction opposite to end action. Suggestion to become more awake, alert at your own space. Maybe a few minutes to 30 minutes self-hypnosis you can do, and longer session, I hear the different suggestions, and you can make these sessions depending upon your treatment goal. And how many sessions for chronic pain? 4 to 10 sessions. You can have the audio recordings. You can learn self-hypnosis daily. And as usual, you need to avoid self-hypnosis during travel or operating a machinery. The best time is before you sleep. And we'll be giving a self-hypnosis and we'll give you some behavioral cues like to sit in the comfortable chair, take a deep breath, hold it. And depending upon your treatment goal, you can record it and read it for the clarity. And here in this induction method, we will be doing pre-evaluation, hypnosis induction, pain reduction script, age progression script, and reorientation. And I would like to inform that hypnosis has borrowed many concepts from NLP and other sciences too. And this is purely experimented, well designed and authenticated method. And I have a lot of reference for this. With this, I will stop about hypnosis. Then after the clarification, we can have a complete session on.
Right. From NLP only, from hypnosis NLP, no?
Yes, ma'am. Because this script has borrowed a lot of things from Milton Erickson, waking hypnosis, and a lot of things are there. And you'll be wondering how it came, whether from this way to that way or that way to this way. But whatever, if it benefits, well and good. Any questions, suggestions so far? Anybody understood about hypnosis? The process of hypnosis? First, you need to have an induction, then suggestions, then post-hypnotic suggestions. Then in this script, I will include age progression and the induction. Yes, ma'am.
Yeah, you can proceed, sir.
One second.
Yes.
Second.
Yes, ma'am. Yes, ma'am.
Yeah. Guna, I have a small doubt.
Yes, ma'am.
When we are talking about pain management.
Yes, ma'am.
See, the existing pain, I'm doing management by self-hypnosis, right?
Yes, ma'am. Yes, ma'am.
Suppose, for example, when we walk or when we run or something like that, pain comes.
Yes, ma'am.
It is coming pain. It is not the existing pain.
Yes, ma'am.
Okay. So if I start walking imagine for a few yards or for few kilometers, I'm not getting the pain. But
Yes.
no, the pain will start as I keep walking. How am I supposed to hypnotize myself for that pain?
You can give the suggestion that whatever I do, for example, our Sumati ma'am is the better person to answer this. But the thing is, you can because she is my teacher in hypnosis, I mean NLP teacher, and the thing is, you can give the suggestions that whatever, for example, if you totally absorbed, even if you might have seen in some of the YouTube videos, one fellow will be with a broken leg, he'll be completing his task. You are getting my point? Broken leg, he'll be completing his travel. One athlete will be broken leg, he'll be walking, he'll be completing his task. So you can give suggestions, whatever it comes, it will not hurt my feelings. But here the purpose of hypnosis is to slow down the message. That's all.
See, I can understand that Gunas, like the broken leg, it is already broken. Okay.
Yes.
He can hypnotize himself, and now I'm going to run. I'm going to
Yes.
compete. So
Well, you cannot
existing
run, but
pain,
you can walk.
and he's giving hypnosis, and he's doing.
Yes.
My
ma'am.
question was, he can walk. See,
You
for
can
me,
walk.
my question was, so many times we experience that, no?
Yes, ma'am.
When we
Yes, ma'am.
travel, when it is in a travel, or when we walk in the airport, or when we walk in the railway station, we will be walking properly only.
Yes,
After
ma'am.
some point of time, the pain will come. I'll not be able to walk more steps or something like that. No,
Yes, ma'am.
that will be effective. No, if I know how to manage my pain.
Yes, you can manage. See, when your thoughts are focused
Hello?
on a particular point, if you are
Yeah.
away from,
So that was
if
my
you are away from
question.
the pain, that's what I talked in my earlier slides. The first one. That means when you have the pain, if you are watching something else, when you are alone, you'll be all the time, you will be thinking about only pain. When you are away, when you are all the time, you'll be thinking about your pain. Yes, it's hurting me, it is hurting me. When you are deeply focused in some other point, for example, maybe a movie, you'll be talking to some person, you will forget the pain. And even you might have seen in kids, they might have fallen. And if you say, Susu, go out, they will simply go. They will walk.
Can a person be hypnotized without his consent?
No, that is the basic concept. They should be ready for hypnosis.
I have one question.
Yes, ma'am. Yes,
Does hypnosis, does it reduce the sensation of pain, or does it just increase your tolerance of that sensation?
both.
Okay.
Reduce the sensation, and you are able to tolerate the pain.
Okay.
The pain is there, the symptom is there, but you can feel less. Yes, sir. Any other questions?
Sir, when you say that hypnosis, so it makes you forget the pain, or it reduces the pain for you?
I'm not getting you, ma'am. It's to get the pain means I don't mean.
No, sir. So for the hypnosis, it makes you forget the pain, or it just reduces the pain for you?
No,
How does
both.
it?
That means when during the hypnosis, your mind calms down. Your mind becomes very calm, and your pain sensation will be reduced. And if you are in deep hypnosis, even you can forget your pain.
So, sir, even after getting operated or something, does this work?
Pardon?
When you're operated, for example, you have gone through an operation.
Okay.
So does it work after that as well?
Maybe we can reduce to some extent. For example, in my own case, I've been operated for this leg fracture. Doctor said that they've given all the SOS medicines. He said, don't take medication. I tolerated pain because I had control over me. Otherwise, it will be very, very painful. Doctor said, if you are not walking, that's all, you cannot walk anymore. So I tolerated pain, and it has become normal.
Okay, sir.
And even, for example, in one of the hypnotic session, in hypnotic circle, they were shown one hypnoanalgesia. And one person from Iran, I think, Iran or some...
Dr. Mahdi Fazil.
Yes.
Mahdi Fadi.
Yes.
Mahdi Fadi.
Yes. You are very good, ma'am, in remembering all those names. Okay, ma'am. And yes, shown even anesthesia, they are using hypnosis. Even for surgeries, they are using hypnosis, but not a single time. They've taken longer sessions, so many sessions.
Can I add here, just for everybody?
Yes, ma'am. Yes, ma'am. Please.
And
Please.
for my own information.
Yes, ma'am.
Mr. K.S. Venkatraman, who is one of the founder members of Hypnotic Circle.
Yes, ma'am.
At the age of 78 or 79, he had to go through a surgery in his heel bone in Indranagar with Dr. Pathasarathi.
Yes,
and he told the doctor, I don't want anesthesia. Doctor was scared to do the surgery. But Mr. Venkatraman insisted that he will not take and then he did his doctor with nervousness. He did the surgery because halfway through, if he feels the pain, what he will do, but it was successfully done. So we don't have to go as far as Iran, for an example. However, what intrigues me is I'm unable to use it on myself. I'm aware of this for so many years. Right now, I'm struggling between my body and mind because I'm in the tipping point of deciding on a surgery. So will hypnosis help me to reduce the pain threshold is a question I have. This is something that I need to get an answer.
Ma'am, see, I know I should not give suggestions to my teacher.
No more teacher now. We're all learners.
Because when you said when something is not working, try something different like that, and you can use a different script or different person's script, because your mind will think that it is me all the time. I'm talking to myself, and it will not work maybe. But you can try something different script from the different author. That will may help, madam. Because when you talk to yourself, it will say, yes, I know about myself, I know, and it's not working for me.
That blocks it actually. That blocks.
Yes. But you can, if somebody says, and all the time, I'm very favorite, my favorite script is from Rishi Kumar Pandya. Whenever I listen to his voice, and that's all. Even though I do hypnosis, but my favorite one is hypnosis by Rishi Kumar Pandya. And as usual, ma'am, whenever I hear your voice, because I'm used to for that. Instead of my voice, if it is somebody's voice, it may be useful.
Okay. That's a good idea. That's a good idea.
Maybe the authority will decide. Okay, it's a very big person, something like that.
Yeah. Also, probably the one part that is recognizing the pain is not allowing the healing part of myself. Maybe.
Yes. Or for your information, the talking part, thought creating part, and the healing part, both are very nearer in the brain, the prefrontal cortex. You are thinking about pain, and all these parts recognize the pain, and the good thoughts and the helpful thoughts created by some parts in the brain, both are very nearer. So they communicate with each other. And you have the thought that, I am talking to myself all the time. I'm here every day. I'm talking to myself. And you have that point you can avoid by using some other authoritative person, script from the authoritative voice, something like that.
Can I dare to ask you to give a small demo?
Yes, ma'am. We are going to do.
Okay.
We are going to do.
Okay. Sir, here, could you clarify about this emotional component of the pain, sir? So I think
yes, when you are emotional, when you are anxious and worried, the gate opens. The spinal cord, the gate. That is why they've developed the gate control theory, and we have a very big mechanism for that. And if you want, I can give you the reference also. When you are emotional, the gate is opened. When you are focused, calm down, the gate is closed. Less information is processed, less information is transmitted to the brain. All the time you are worried, all the time you are emotional, the gate is open. Actually, it is a natural mechanism for healing the pain. You need to take some action. So that is why the gate is open and closed.
Okay. So through hypnosis, we are giving some suggestions. Through that, we are making some changes in the emotions. So
we are actually calming down the brain. We are not making any changes. We are calming down the brain. When the brain calms down, the gate is closed.
So calms down means what is the emotion you're indicating, sir? Exactly.
No, for example, we have, I have told you the 4 or 5 parts. Anterior cingulate cortex, prefrontal cortex, and all these cortex. When you under hypnosis, all these parts, the overall brain activity is getting reduced.
Okay, okay.
So naturally, whatever the emotions that you have, it will not have any impact on that.
Okay, okay, because the parts are not working.
Yes, ma'am.
Okay, okay, sir. Yeah, got it, sir. Thank you, sir. Thank you.
Yes, ma'am. And now, yes, ma'am, please.
No, so then what do you say? If the gate is open, it is fine only. Only when the gate is open, we'll know how to close it.
Yes,
So
when the gate is
if
open.
we are emotionally down,
Yes.
you mean to say that is fine. So then the gate is open when we are emotionally down or anxious or something,
Yes, ma'am.
right?
Yes, ma'am.
So then we will know how to close the gate. Am
Yes.
I right?
Yes, ma'am.
Yeah.
Any more questions?
Yeah, Guna, I have one question. to
Yes,
you.
sir. Yes, sir. Yes, sir.
If you take an example of arthritic pain,
Yes.
okay, arthritic pain has got a very clear medical etiology confirming why you develop the pain. And that is having its origins in the immune system.
Yes, sir.
How is self-hypnosis going to help a patient with chronic arthritic pain?
Still, you will have the pain.
Yes.
Still, you will have the pain. That pain component is not cut at all.
Right.
But the suffering can be reduced. The suffering, the pain is there. Already the parts are damaged.
Mhm.
Everything is there, but you will feel the less sensation in your mind. So it is there in my leg. Okay, let it be there. No problem. You will not care about that. Your mind, because your mind is calm.
Mhm.
The arthritis problem will not be solved. It is there. It is because it's a medical condition.
Correct.
You cannot cure it. But the response to your brain, response by your brain is lessened.
Mhm. Yeah, maybe to some extent, but you're still going to experience the pain.
Yes, definitely.
Because that pain cannot leave you.
Yes,
The same thing holds true even for someone having a problem of the arthritic knee, and then they go for knee replacements.
Yes, exactly, sir, exactly.
There, the only thing that seems to help is a knee replacement. I don't know whether any amount of hypnosis would help.
Pardon, sir?
I do not know if with the patient who's destined to go for a knee replacement,
yes, sir,
whether hypnosis would of any kind would actually help.
If there is a physical damage,
yeah,
that we cannot do anything with hypnosis.
Okay, fine.
The damage will be there.
Okay.
But the suffering we can reduce.
Okay.
Suffering by the body we can reduce.
So what is very clear is that the hypnosis may help you to kind of to some extent overcome the pain.
Yes.
But until the causative element is removed,
yes,
the pain cannot be removed.
But we cannot remove the causative element.
No, that's why surgery comes into the picture. No?
But even the surgeries, even after the surgeries, many people feel very severe pain.
Yeah, no, that pain would be there for some time until the articulation of the joints is restored.
Yes, exactly.
Okay, and that restoration of the articulation is done through good physiotherapy.
Yes,
and it invariably takes time. Some people come through in 3 months,
for example,
some 6 months, some take even a year.
Maybe within a year, within 1 year or 2 years, it may take. We do not know.
Like I have a problem.
No, sorry to interrupt. It doesn't take a year. It takes 3 months.
Yeah.
No, not. I don't mean that particular case.
No, generally now, the way the surgery is being done, in 3 months, people are highly mobile.
Yeah.
No, maybe for that surgery, generally, any healing part may be taking place within a month, maybe 2 months, 3 months, or maybe even a year.
It doesn't take a year unless there is a complication.
Yes.
That's the difference.
Even after surgery, many people are not all right. That's my point. For example,
I don't know.
for some people.
I don't know how true that, because I'll go with Sumati ma'am's statement that if the surgery is done by an expert,
Yes.
who is very thorough with handling the scalpel,
Yes.
okay, you can have a very clean job done, and as she rightly said, in 3 to 4 months you're back to normalcy.
Okay. Yes, sir. Yes, sir. That's there. But during because of aging, you will get a lot of these pain problems. Pain problems are very, very common.
So even in that stage, if one is going through a surgery and they're having pain, hypnosis can help them reduce the pain even post-surgery.
Yes.
Okay. I'm asking these questions because I'm on the verge.
Mm. Mm. Madam, you are the master for all these things.
There is nobody who is a master, nobody who is not vulnerable. Every one of us are vulnerable.
Yes, ma'am.
So our own, like I said, the perhaps because of hypnosis and NLP, I've been managing for 15, 16 years now, in spite of the pain. Now I'm in the verge of coming to a decision about it. So
Yes, ma'am.
this providence that we are having this session today, and I will definitely keep this. In
Sure,
fact, Narayan
Yeah.
wants to share something
Sumati,
about
the gate is open now.
Yes.
Gate is time. Every day I'm closing it, Kalpana, believe me. Narayan wants to share something. Please, one
Yes,
minute.
ma'am. Yes, yes, sir. Yes, sir. Please.
Yeah, once when it so happened that I had to go to a dentist first time.
Yes, ma'am.
So first time it was, something when I see people coming out, they are on the verge of some tears, like it's paining, it's drilling, it's so many, all these things. So I was
Yes, sir.
also thinking that it may be there. But what I did, because we know hypnosis, I asked Arvamudam to come, and then we did sessions together.
Yes, sir.
Believe it or not, that after getting out of the thing, my daughter came to pick me up, and
Yes,
I
sir.
came out smiling.
Oh, wow, wow.
This root canal treatment.
Oh, wow, wow, wow.
See, so the thing is that it's all in the mind.
Yes, sir. Yes, sir.
Again,
Exactly, sir.
we may not feel the pain. Pain may
Yes.
be there, but we may
Pain,
not.
yes, sir.
That's what I wanted to share.
Yes, sir.
Narayan is going to hypnotize me for that, or you are going to.
Even after.
Yes, Narayan sir only started the hypnotic club.
Yeah, see, we are aware from 74, and it has
Yes,
helped
ma'am.
so many of our life's events.
Yes, sir.
And so it is not like there is we will always be strong. I think now personally I need to work on the strength to use that part of the mind.
Yes, sir. Yes, ma'am.
And like you said, maybe the script for the pain, this thing, I should take it from you and then utilize it to help myself right now.
Sure, ma'am. Sure, ma'am. But even you can use some other person, because all the time you are using your own voice. Maybe you can try with some other person. Maybe Narayan sir may help for that, or some other person.
He can. Where can we access the script?
Yes, I will give. I will provide, madam. I will provide.
Thank you.
Yes, ma'am. I need a volunteer. If there are no more questions, we can go for induction.
Just one doubt, sir.
Yes, ma'am.
Sir, you said when we are answers and the gate is open.
Yes, ma'am.
When we are focused, the gate is closed. Focus means focus on the pain. Huh?
Focus on a particular activity, not on the pain.
Okay.
For example, you have the pain, you are watching a movie, or you are deeply listening to a song.
Yeah, we are diverted.
And even bhajans or something, some different activity, if you are focused.
Okay.
Not focused on pain.
Okay.
Then
Focus
again,
on
you
some
are
other
in
activity.
the same circle.
Some other activity. Okay.
Yes, focus on a simple activity, because when you are focused on a single activity, your brain tends to calm down.
Okay, sir. Okay. Thank you, sir.
Yes.
Sir, one question, sir.
Yes, sir. Please.
Sir, actually, one of my relative is suffering from a multiple myeloma, bone cancer. Sir.
Yes, sir.
He's getting a severe, intolerable pain, sir.
Yes, sir.
He's crying like anything. His
Yes,
age
sir.
is about 75.
Yes, sir.
So if we hypnotize, we can reduce the pain intensity, sir.
Yes, we can reduce, but we need to work on different strategies. For example, the actual clinical hypnotherapy will be started in different sessions. For example, for the starting itself, they will take 2 sessions. The first, they need to evaluate the pain and what are the things that works for them, and they should get the feedback mechanism. For everything, we have the standards. Even for this cancer therapy, also we have separate protocols available, and you can add that, you can get it.
It's very important to get it done by someone who is properly trained.
Yes, ma'am. Yes, ma'am.
That's a very important point.
Very, very important. Exactly. Very, very important. And I got the opportunity to train by Mark P. Jensen. He's from University of Washington, and he is a pioneer in this field. And he has done very fantastic job. And maybe during the February, March, again will be coming to India. And I posted that poster in our group also. But I don't know, nobody has come for that. Around 60 people came for that session. Yes, sir. Anything more I can add?
Nobody else volunteers, I'll volunteer.
Yes, ma'am. Great, great.
As usual, I ask the question first. I ask one first. And,
Yes, ma'am.
But I want to give opportunity for others who have never experienced hypnosis. If someone is willing to volunteer, I'll be very delighted.
Yes,
Please.
ma'am. And I can share all these materials to anyone who wants to get better knowledge about this hypnotherapy. I have all the class materials, and they can contact me, and through mail or WhatsApp I can share, no issues.
Yeah, you can share it to our secretary Indu.
Yes, sir.
And she will share it to the participants.
Yes, sir. Yes, sir.
I'm not sure that can be shared with everyone who hasn't been exposed to.
Yes. And those
I'm
who are
not sure.
keenly interested, those who are keenly interested. Yes, I want to know this. If you are keenly very much interested, you can get it, no issues. And any more questions? I can go for a simple demo. It will take around 15 to 15 minutes. And it is around already 6:30, 7:30.
Yeah, if there are no takers, Sumati, go ahead.
Yes. We can.
Anna, you said you get paid when you walk. Now, why don't you volunteer? Volunteer. Kalpana's gone to make coffee.
Yeah, Sumati, only when I walk for a long distance.
So, you use this opportunity now, be a volunteer now, come.
No, she'll have to start walking.
So, Sumati, my question was, when the pain develops, how are we supposed to?
No, and the question la vitruma. If he wants a volunteer, will you volunteer?
See, for me, no, I don't know whether my இல்ல சுமதி எனக்கு வந்து இல்ல am I audible properly எனக்கு ஏனா அப்பப்ப பிரேக் ஆகுது
இங்க எங்களுக்கு பிரேக் ஆகுது பிரேக் ஆகுது
Kalpana, just volunteer no Kalpana, since you do have a need, just volunteer and experience hypnosis.
Sumati, she is in a place where connectivity is very poor.
Oh.
I mean I'm out of station. I'm in my sister's place.
Oh, okay. So you're not with Surya, that is a connectivity problem. Okay.
I volunteer, ma'am.
Yes, ma'am. You can come on video and you can sit in a comfortable chair. We'll have some.
To show your video, ma'am.
Yes.
Yeah. Yes, ma'am. Hello?
Yes, ma'am. Yes.
Yes. Am I visible?
No, you are not. You are invisible.
You are invisible.
1 minute.
And one more channel
There's
is
television in the background. Surya, can you Someone is
No,
having.
that is Bhuvneshwari. I think she has to mute her TV. I don't know what is it.
No, it's not working. If she mutes, you can't be by a subject. He has to see us, see the volunteer. Otherwise, he cannot hypnotize. He's actually taking. What, Bhuvneshwari? What happened?
Yes. Yes, I switch off the TV.
Yes, great.
Am I
ma'am.
visible now?
Yes, yes, ma'am. Yes, ma'am.
Yes. Yes, sir.
So we need to work on the painful thoughts. And I would like to ask few questions.
Yes, sir.
Do you have any pain?
Sometimes I'll have, not now, sometimes I'll have headache.
Headache, okay.
Yeah.
What is your thoughts about your pain? Do you think that you have all the skills needed for your pain?
But sir, I can't.
Do you have the skills needed to control your pain? Do you think that because I don't have control, so when it comes, that's how my chapter is closed? Something like that. Do you feel?
No, not that. I'll take medicine.
And no, you may take medicines. Then
Yeah.
what are the thoughts about your pain? That means,
Sorry about
do you have
interruption.
the
Can we
skills?
Sorry about interrupting, Guna.
Yes,
Can the team actually show both of them, please?
Yes, I'm.
Yeah, it will be helpful to show Guna, pin Guna as well as initially
Yes,
by Surya or somebody do it, please.
Sir, I'm doing it. 1 second. Now give me. You are both
Yes,
on
great.
spotlight now.
Yes, great.
But I think there are a couple of others also that you spotlighted. What's happening?
No, say like all others, if you switch off your video, only we'll have Guna sir and Bhuvneshwari ma'am.
Suresh, just spotlight both of them. No, rest of us will disappear.
Yeah,
Yeah,
Suresh sir,
exactly.
actually I had spotlighted both of them. Anna, நீங்க வேற ஏதோ ஒரு
I'll come back again.
ரெண்டு பேருமே
Yes,
தெரியல.
Yeah, that's
correct.
fine. That's perfectly fine.
Yeah. Now better.
Yes. And can you live a consistent life without even the painkillers? You need all the time. You need painkillers.
Yeah.
Only.
Whenever I get headache, I'll take Saradam.
Okay. More than that, you have any body pain like knee joint pain, something
No.
like that.
No,
Okay.
not like that.
So, do you, because of pain, are you able to work freely?
Not much, sir. If it is very severe, I am not able to.
Yes, that's the thing. And do you think that your pain is the symptom of the physical damage? Yes, I'm getting old. The pain is coming. Do you think like that?
No, not like that. I don't think so.
You need to take all the time lot of efforts for this eliminating the pain. Am I correct?
No,
always you need medications.
Yeah, whenever it is for some time I won't take. If it is if it's still persisting for more than 1 hour, I'll take medicine. Saradon I'll take.
Okay. For Saridon and all, it is very, very common. And if you have the chronic pain, we can have this deeper session. Or it was a simple headache means for this much big sessions are not necessary. If you have a deep pain or chronic pain all the time bothering you, you can take this session.
Okay.
Anyway, you are having come for this as a subject. We will have some induction and we will have this entire process. And after the induction, I will give this already script to Indu ma'am, and I am using the safe place induction. So I'm giving you some money. Yes. If you have the back pain, you can also come. If you have a persistent pain, chronic pain, this will be the fantastic pain.
Yeah, my brother has always back pain, leg pain, and
No,
everything.
no, for brother, I cannot do anything.
Yeah.
But Indu ma'am, you can participate.
Sorry to interrupt, sir.
Yes.
Yeah. Actually, I went
So-
through the root canal. I went through the root canal 2 days back.
Mm.
And right now I have a pain. I'm suffering from it from past 3 days
Okay.
post root canal.
Mm.
I just stopped my antibiotics for 2 days because I have more aversion towards all these medications. So I stopped it for 2 days. And the day one after the root canal, it was perfectly all right. So I called up my dentist and told, just I have the medicinal, I mean, the pharmacy smell what we get from the medicines. It was too much for me after the root canal, and there was no pain existing on day one. But yesterday was day two. From yesterday, it restarted. It's like too much of pain, and I'm still in pain. Can I act as a thing like? Can I take it?
Maybe maybe you can do, but only you can learn these techniques, and because we need to
Okay.
modify the suggestions according to your pain. But I have made a demo for chronic pain. We have very severe pain, and for severe back pain, it is intolerable. And I need to get the relief. For that, I have made some.
Okay. No, as the meeting started, I was like, my full focus is on the
Yes,
meeting, and I'm
you
trying
can
to
do one
observe
thing,
it.
madam.
But still, I'm at one side, the pain is there.
Yes,
So I
ma'am.
just took up your point, like you need to focus on some other things so that you get a relief. Maybe that the pain sensation may come down.
Yes.
But maybe for the first time, not able to focus it properly. I don't know, because I have never experienced it, never tried all this.
Yes,
So now I'm trying to focus. My full attention is on the meeting. I want to get to know deep about this. But still at one side, my toothache is too much that
Yes,
I'm not.
ma'am, we'll do one thing. And I will be doing demo on maybe Madam Indu ma'am, because she's
Okay.
having this low back pain. And
Oh,
others
okay,
can
okay.
also listen to that. And
Okay,
it's a generalized script only.
Okay, sir.
And you can experience hypnosis.
Yeah. Thank you.
The
Thank you.
thing
Just
is,
want to add.
Indu ma'am, you'll be given with some money, and you can go for a vacation. Where you'll be going? Your favorite place.
Somewhere we have been already, or it can be a
Yes,
place.
any place. You have the paid vacation.
Maldives.
Paid vacation with beautiful water and green sceneries.
Maldives.
And yes, and I need to use Madam Hindu ma'am and myself to be spotlighted.
Okay, 1 second. Sir.
Others can listen to this.
Okay.
Yes.
Yes, sir.
So, settle back.
Yes.
And allow yourself to sit comfortably as you can right now.
Okay.
Go ahead and just allow yourself to come in a comfortable position.
Okay, sir.
Take whatever time you need.
I'm good to go.
Yes, and notice how it is possible to increase your comfort right now. Take a deep, satisfying breath and hold it just for a moment. Now let it go. And let yourself notice how good that feels. And now allowing yourself drift off. You can imagine yourself in a wonderful, beautiful, and a very safe place, as you mentioned, Maldives. As you step into your safe place, it's a comfortable place.
Yes.
You notice a sense of relief, a sense of deep physical and emotional comfort. It is like a vacation from stress. You can really let go, knowing that you are so safe, with nothing to bother you and nothing to disturb you. taking your own time to really be there in that place. Now, this is your time, a time to charge batteries. You step into the place and you can feel the ground or floor against feet. It is a beach in Maldives Beach.
Yes.
You can step into the sand. You can feel its warmth.
Yes.
On your feet. Actually, you can feel the warm sand, the texture. And as you look around, everything is so beautiful. Look into the sky. You can see that it is incredibly blue, a blue sky, as you ever seen. And if there are clouds, you are just floating there. You can see easily white and fluffy. There is nothing at all that you have to do. Just be there. No one you need to please. No one to take care of. You can smell the air, beautiful air. Hear the sounds, bird sound that are associated with your place. The sounds that you associate with feelings are so relaxed and so free. Perhaps there are plants and you can have the focus of leaves. They are so green, perhaps waving. Feeling the breeze against your skin. The temperature is just right for the feeling, so relaxed and yet so focused. And in front of you, you can see a soaking tub of water. Imagine, everything is in your imagination. It is as if it were built just for you. And know that it is healing water in this tub. It can make you feel even better, even more relaxed, comfortable, and strong. You might decide to allow yourself to move to the tub, to sit back, feeling the support, supporting your head above the water. And the water feels so good. It is too. Just right temperature. The perfect warmth or coolness. You can actually feel the water all around your body, breathing so naturally and easily with your head supported. Maybe noticing the healing liquid soak into the areas of your body that could benefit from the feeling better, stronger, and more energized. And the state of focused awareness is so healthy for you. It strengthens your immune system. It relaxes and gives you more energy. It allows mind to relax, yet feel more focused at the same time. You might enjoy it. Just letting yourself go and allow your mind and body to heal as you experience timeless feeling of relaxation. With every breath you take, breathing comfort in and breathing discomfort out. Breathing comfort in and breathe out discomfort. You can wonder how you can be feeling more and more comfortable right here and now. You may be pleased, of course. You may be surprised. That is so much easier now. Simply focus on relaxation and comfort. So, to enjoy the relaxation, peaceful comfort of each breath, so simple, so natural to attend your breathing. At the same time, you can notice almost as side effects that any uncomfortable feelings drifting farther and farther away. You might even imagine this feeling as image, perhaps as leaves on the stream or a fire burning on a piece of wood or some image. You can actually see them. All your discomfort in the form of an image. I don't know what image is, but you do. You can see the details. Watching the image change, perhaps floating. And maybe now you can take the whatever image for the uncomfortable sensation and imagine in your mind's eye, lowering the image into a strong box with a secure lid. Into the box, the feelings go. You can see yourself shutting the lid and securing it, muffling the sensation and putting this into box, into the second very secure box, shutting the lid. The sensation are there in the muffled quiet and putting the second box into the third box, shutting the lid. Nothing can get out. Then you can use it, your creativity here. Imagine sending this box far away, far, far away. Maybe into this deeper space, across the ocean. But really picture it going far away, far, far away. So much easier to ignore now. And with those sensations so far away, it is even easier to feel the discomfort of every breath. So easy to let yourself daydream about the peaceful place. Imagine a happy time in your life or happy time you would make like to have, letting yourself feel free right now. Just let your mind wander over the pleasant memories and sensation. Such a pleasure to be there with nothing to bother you and nothing to disturb you. With every breath you take, breathing comfort in, tension or discomfort out. Just notice how naturally you feel more and more comfort. Any feeling of discomfort seems to have lessened and maybe even disappeared altogether. Like some memory long forgotten or something we have stored away, but is no longer part of your awareness. Letting each breath you contribute to your comfort and well-being. Of course, any sensation of comfort you feel or sensation that you have created yourself. These sensations are within your power to create, and you can stay with you. They can last beyond sessions for minutes, hours, and days, even years they can come. A permanent part of what your mind gives you all the time, as natural as breathing. Any benefits from your self-hypnosis are becoming and part of what you are and who you are. And now if you wish, you can allow your close eyes to enjoy the state of hypnosis, taking time. You can take your time You need to come back to the present here and now.
Yes, sir.
Yes. How do you feel?
It had a very tranquilizing effect on me.
Yes, ma'am.
And twice I had just moved to check how the intensity of the back pain had, because I was experiencing that discomfort and pain when I started the process. Then 5 minutes down the thing, I moved a little. I could see the intensity come down. It was still there. And again, when you were, once you said box it, all the discomfort and leave, I could notice a sharp reduction in that discomfort
Great.
and level of pain.
Great.
Yes.
So whatever I told you, you've seen it. That means that beautiful base.
Yes.
Well, then that means working very well. You are very positive. Whether the session was very positive or
Yes, yes, yes. It had a very soothing effect, and also I could notice, because I kept moving to check how the pain is, and I could see the discomfort level come down
I see.
a lot. Yes.
Yes.
Yes. Thank you.
Thank you, ma'am.
Thank you, sir. Thank you very much for taking me through this
Yes.
process. I was
Yes.
waiting for others, in fact, but I think it was just meant for me to be in this process and benefit from it. Thank you so much.
Thank you so much, madam, for volunteering.
Thank you, sir.
And any questions regarding this?
Now, because may I ask?
Yes, ma'am. Yes, ma'am.
Okay. So I can understand if we were to initiate or lead someone else into the process to, like the narrative that you had, if we were, because we are looking at this as a self
Yes.
help process.
Yes.
To vividly describe what, like the logical mind will be in action when we are associate, like let's say if someone is wanting to visit a desert safari or mountain, something like that at that point, and then you are making the logical connection to describe that area.
Yes, ma'am.
So how do you bypass the critical factor and also allow the subconscious to settle in and let go? How does both happen? How do you lead yourself into this?
Once I heard a lecture about Rishi Kumar Pandya. In his lecture, he will be describing. One person will be saying, "You cannot hypnotize me." Immediately, Rishi Kumar Pandya, "Oh, I cannot hypnotize you. Okay, you come here. I will hypnotize you." Immediately, that person will come, and he will say, "So you are already in hypnosis. You obeyed my command." What a fantastic genius! Those words are still in my mind. And I'm thankful to Narayanan sir. He gave me that audio.
Okay.
And you come here. You come here. I will hypnotize you. Immediately that fellow will come. So you already obeyed my command. Then you are in hypnotic state one day. I'm giving you suggestion to come here. You obeyed. So the main part of hypnosis is it will bypass the natural critical. What you said? You said something.
The logical mind.
Logical mind, it will bypass because it believes everything. Then you are already vulnerable for suggestions.
Yes.
My
question came rather from a space of self-hypnosis. So when you are doing this for yourself, how do you balance both, giving the instructions and also slipping into
you need to record.
Then that answers it for me.
You need to record either with your own voice or somebody who is
okay. Then that quite answers the question.
Yes.
I was thinking we are playing the role of the
no. That is why in the beginning itself I told you need to
somehow
record.
I have missed.
First you need to decide the script. You can use any induction method.
You
can use any induction method. So induction method to induce the hypnosis. Then comes pain reduction script. Then third comes the post-hypnotic suggestions.
Okay.
That should last, whatever being told in the hypnotic session, it should last beyond the session.
Actually, I want to share, sorry to intervene, but I want to share this for the benefit of others as well. You know that sentence when you said the effect of this session will last for a few minutes, few weeks, few months. And when you said last forever or so last for a long time, I was feeling so grateful, and I wanted to even acknowledge you at that point, because it was such a relief to hear, because one
Yes.
part of me was asking, "Idi evlo neram tango?" That's the voice I had. So when you said that, it was very reassuring. Okay, this will stay, the work or the healing benefits will stay for longer. That was very, very assuring at that point.
Yes, ma'am. Yes, ma'am.
Thank you.
And the last one part I missed it here is the age progression. You might have heard about age regression. That means going back to the past. And age regression is also possible in the hypnosis script, and that I have given to you, age progression. And after the sessions, or 5 or 10 sessions, you can imagine your posture, your way of talking in the same script. You can include in the same script, and that will give you the better relief. For example, if tomorrow morning you are given with the post of some army officer, your posture will be entirely different. Just one word. Tomorrow you are lieutenant colonel. That's all. Your posture will be entirely different. Those words can be included in the script, because mind cannot believe whether it is true or not. Whatever suggestion is given, it will accept. Yes, I am the lieutenant commander, something like that. So mind cannot verify everything. So your logical mind will verify, oh, this is good or bad. The unconscious mind will not verify anything. Whatever it comes, it will accept. Any more questions?
Yes, sir. Will you suggest any alternatives? This was very powerful and useful. Boxing it, and another layer of boxing, and another layer. So it's like done.
It is a time-tested script, and
yes.
And
anything
you can
else
have
in
your
place
own
of
method.
that?
Even in NLP, we have a lot of techniques like this. NLP, we have very beautiful techniques, and you can use any technique. This is it is up to you, because you need to structure according to your need. You need not use the same script. Whatever suited to your conditions. For example, if you are having different problem, you can formulate different suggestions.
Okay, sir.
Okay, fine.
Thank you.
Thank you, ma'am. Any other questions?
Sir, please excuse me.
Yes, ma'am, please.
Sir, before that third point, only post hypnosis suggestions, no?
Yes, ma'am.
First is?
First, you need to induce, that is induction.
Okay.
Then comes suggestions. Then
Okay.
post hypnotic suggestions.
Okay.
And if you want, even you can add the age progression.
Okay. That suggestions, what is the difference between suggestions and post hypnosis suggestions?
Suggestions for your particular problem.
Okay.
Post hypnotic suggestions that should last even after the hypnotic session. You need to suggest your mind even after the hypnotic session.
Okay, okay.
This should work even after the session.
Okay, okay, okay,
yes,
sir.
That's the post
Thank you,
hypnotic suggestion. Yes, ma'am.
Okay, sir. Thank you, sir.
I have a question. Is there any kind of a music that gets you into a hypnotic state? For example,
yes, there is lot we have. Even you can use binaural music, that is two headphone. You will hear two different sounds.
Okay.
That is available plenty in YouTube, and you can even any calming music that you can listen.
Monroe Institute has the research on that.
Who?
Monroe Institute. MONROE. Monroe Institute has.
Okay. Yeah. Monroe Institute. And one more thing, when you talk of hypnosis, see, for people who are very rational. Now, for example, if I am asked to imagine that I'm in a garden, it's very difficult for me, absolutely difficult. But if I have if an idea, I can toy with an idea for anything. How do you do with? So, do you check what is this person's imaginative capacity?
Yes. You should have this induction. The first induction. After the first induction, you should get the feedback. whether you are able to imagine,
Okay,
whether you are
okay,
comfortable,
okay.
what kind of duration you need, because sitting for 20 minutes, 15 minutes, it may not suit you. Depending upon your need, we need to have the, we can redesign. The first session itself, it's not complete. So depending upon your need, but we have the induction response questionnaire also that you should do, because whether you are comfortable with the script, comfortable with the whether can you imagine those things, did you see all those things, you need to ask all the questions. And
now,
you can
one more
redesign.
question with Indu. See, as you were talking, Indu was shaking her head like yes, yes, yes. Now, I don't know if Indu was aware of it, but if she was consciously doing it, then would it not disrupt the flow?
No.
From
as long as she is continuously hearing.
Yes.
Okay.
As long as she is hearing, nothing will affect.
I was aware and I wanted to respond and acknowledge also.
Yes.
May I add, it is not consciously nodding. She was her body is responding to the inner message. That's it.
Yes, that's it.
The unconscious movement, she is not deciding to do it. It is, I want to acknowledge, and then body takes its own expression. So you can make out from the expression whether it's a conscious or unconscious gesture from the way she nods.
Okay. Now, do we also tell the client, now, do not open your eyes unless I tell you? And isn't there a count-up process before you?
Yes, we have all those things, but this is in an informal induction process. So I have not told all those things. But before doing induction, we need to tell the client, this is what we are going to do. We need to inform that this is what you are going to experience. That we need to tell. See, first I will do the induction process, then I will give the suggestions, then it will be like this. You need to go for a long, you can inform.
No, see, I'm looking at, thanks to Mr. Narayanan, in the mid 1970s, he was with America. He had brought over Rosi Kumar Pandya here, and in Chola Hotel we had a program.
Yes, sir.
At that time, without telling the participant, now I'm going to, we will be giving you an injection. No, he demonstrated. A needle was poked and that person was totally unaware of it. But he did not talk about anything like that. And then just for the demonstration to the group, he just gave that injection.
Yes,
I mean, poke the needle into the person's.
Yes, yes, that is also possible.
Okay.
It's also possible. I have seen those demonstration by our Pradeep Agarwal, and there are a lot of videos are available.
Okay.
Yes, sir.
Varghese, if I may add, because I'm in this I was there when all these things happened.
Okay.
The purpose there was to demonstrate how the person's hypnosis, how people respond to stimuli under hypnosis and anesthesia, etc. Okay. There the purpose was to demonstrate and learning purpose. But here, when you're talking to a client, that's what Guna is saying. You need to prepare the client for the different stages of hypnosis.
Yes.
Okay. Right.
Yes.
Sir, please excuse me. That induction is that visualizing the natural scenes, pleasant memories, areas. That is only the induction means.
Induction means we have lot of different methods are available. We are making you to focus on a particular point. That is the induction.
Okay.
We are creating an awareness to focus on a particular point. That is the purpose of induction, and we have several methods. There are several hundreds and hundreds of versions are available for induction. And normally,
where can we get that?
Pardon?
Where can we get those?
It is available everywhere. It is in the internet. We have a lot of induction material available. Lot of hypnotic books are available. It is available everywhere. But here I am preferring only 3 methods. That is classical countdown. I prefer classical countdown, and the relaxation and the safe place induction.
Bhuvaneshwari, if I may suggest, please attend one program before going to the next.
Yes, I
must attend a program then only we'll understand the fundamental principles of what we need to download.
Yes, ma'am.
Okay, okay,
Yes,
okay,
ma'am.
okay.
Yes, ma'am.
Okay, ma'am.
Exactly, sir.
Nothing can substitute learning from somebody and then adding on with the net, because the field is like that. You will find better results when we are trained and then we do it. I give a lot of importance for training because this is a very intense field.
Okay, yeah, I understand, ma'am. Yeah, thank you, ma'am.
So I have the
Thank-
scripts and books, but it will not be useful to you unless you learn. You have the wish, we have the will to learn. I have a lot of books and videos, but it is not going to help you unless you experience it. Anything else to add? And
So the three things you said, classical countdown and relaxation, and the third one, I just want to know
safe place induction. That one I used for madam.
Yeah,
For this
thank
safe
you,
place
sir.
induction.
Yeah. Just wanted to know the name. That's
Yes, sir.
safe place, huh?
Yes, safe place
That-
induction.
Okay, sir.
Guna, sir, how long will the age progression portion of the next bit of what
It
you were
will be
suggesting? How long will
another
it take?
10 or 15 minutes. It will maximum or 10 minutes.
Okay.
I am, in fact, in fact, I am really grateful to see Narayanan sir and Sumati ma'am, because these two people introduced me to this field. Before that, before meeting them, I do not know anything about NLP, anything about psychology, anything about hypnosis, nothing. And they've given a lot of support, and I owe my deep gratitude as a teacher. And she has given a lot of books for me, and it's my home. In fact, I can say Indiranagar, that is like my home, I can say. I owe my deep gratitude for ma'am. I am really delighted to see you, ma'am, your face. And in fact, the first 10 minutes it went wrong something because of seeing you. You cannot talk in front of your teacher. Am I right? And that's really tough for me. And she's a master, and I am talking to her. That was really. So I cannot. I don't have the words to say for that. Thank you, ma'am, for all the encouraging words and all the knowledge, all the wisdom that you have given. Ma'am, you are muted, madam. Ma'am, you are muted.
You're yourself a great learner, and it's wonderful to see your growth, actually.
No, when I saw your image on the screen, I was shocked. Oh my God. I never, but I managed. Thank you, ma'am.
I didn't realize that that's an electrifying effect.
So you have got good marks from your teacher, Guna.
Yes, ma'am. Yes, ma'am. Thank you so
Flying
much.
colors, flying colors.
Thank you, ma'am. Thank you for those nice words. And I am really thankful to Narayanan. Whenever Narayan sir is one of the greatest inspiration for me for all these things. Thank you, sir.
Excellent, and your preparation and the way you handled today. It's a good introduction to pain management using hypnosis. Thank you so much for
Thank you,
coming.
sir. Thank you so much, sir.
So one small suggestion, if there is time, either Narayana or Guna, can we have a relaxation process?
Guna can do the mass relaxation.
Mass relaxation, yes.
No, I prefer madam. And it is very long time since I met her. And I prefer madam because I cannot get it back.
No, Guna, it's like this. Today is your evening. And
Maybe it's your special invitee. Okay. Yes, ma'am. Please.
Special invitee.
As per Surya's request, you only need to do the.
No. I have already done one demo.
That's okay.
It's okay. It's okay.
Please, ma'am. We are waiting for you, ma'am. Please.
No.
Yes, we are waiting for you. Yes.
No, Guna. It is not correct. And I want to be hypnotized by you, which has never happened. So let's go for it. Give me the opportunity to also get the benefit of relaxation from you. Come on. And then,
Maybe
you know,
we start 5 minutes.
Yes,
relaxing.
we can start within 5 minutes. And there are some very good books are available in the internet. And this Yapko, this is a fantastic book. Trance Work. Name of the book is Trance Work. That is a classical book in hypnosis. And as an Aladdin, the cognitive hypnotherapy, that is also awesome book. You can read that, and it's very book. And if you are very interested, you can buy this original book also. It is costing more than 3,000, but it is available in internet freely. And
Sir, Guna sir, can you type those book name in the chat box? It will be helpful for us.
yes, sir, it is there. It is. I've shown you in the PowerPoint. I will show you again. I'll show you.
Yeah.
This is the book, one of the classical book in trance work by Michael Yako. Now they have the 50th edition. And this is about cognitive hypnotherapy. It is purely scientific book. As an Aladdin, once he visited India also. These are the two classical books on hypnosis. This one is a very, very fantastic book. I have the copy and I have read this book, Michael Yapko. Something went wrong with my computer. I don't know. Sorry, I'm something. 1 minute. Yes. Okay. We will start and just settle back and allow yourself to sit comfortably as you can right now. Go ahead and just allow yourself to the most comfortable position. You can take whatever time you need.
The video. Please have your videos open for him to calibrate, please. Not the scene, Sharima.
Yes. And notice how it is possible to increase your comfort right now. Take deep, satisfying breath and hold it for just a moment. Now let it go. And let yourself notice how good that feels. Yes. In a moment, I will count from 1 to 10. As I count each number, take a deep breath, satisfying breath, hold it, and let it all the way out. And as I count each number, you can imagine that you can feel yourself letting down. One level of comfort at a time, deeper and deeper. Experience the comfort and relaxation. Perhaps you will imagine yourself going down the elevator or lift. Perhaps you will picture each number as a count. Either is fine. With each number I count, just allow yourself to settle down into deeper and deeper of comfort and relaxation. So that when you reach the 10th level, you can really enjoy and experience the deep, comfortable ease. One level down into deeper comfort, and you take another deep, satisfying breath and hold it. Then let it all the way out. 2 levels of countdown. That's right. Take another deep and satisfying breath. 3 levels down. And now you may even notice yourself feeling more comfortable. Notice different parts of body that are relaxing or feeling heavier. Picturing each number as a count and take another deep breath. 4 levels down. Maybe noticing a deep, relaxing and restful heaviness in your forehead. Feeling it beginning to spread across the eyes, across your face, into the jaws. Deep, restfully heavy. When ready to take another deep breath, hold it and let it go. 5 off down. We're already beginning. Perhaps to really enjoy this feel of relaxation with comfortable and at ease. When you are ready to feel even more comfortable, take another deep breath, hold it for a moment and let it go. You can really notice beautiful relaxation. 6 levels down. Perhaps noticing that the sounds around you become more and more part of your experience. Comfort and well-being with nothing to bother, nothing to disturb. And take another deep breath, hold it and let it go. 7 levels down. Right now, there is nothing you have to do. Nothing is required. No one to please. No one else you have to take care of. Just take this opportunity. Feel deeply comfortable and at ease. Let this sink in. When you are ready to take another deep breath, satisfying breath, hold it and let it go. 8 levels down, perhaps noticing that your body relaxes more and more deeply. Your whole body feels as if you're becoming heavier and heavier, really sinking deeper and deeper into the comfort. Take one more deep breath. And the 10th level of relaxation. Notice how deeply comfortable, how much at ease you can feel. Be there for some time and enjoy this state of relaxation. Yes. Yes. Be there for some time. And imagine that you are able to travel into future. You might imagine going to the tunnel of time or experience yourself stepping into a special time machine. You move into future when you are managing even better. I don't know when that will be. Maybe a year from now, or 2 years, 5 years, 10 years from now, you are moving forward in time. Then stopping at some point of time. When you are doing well, very well, you have successfully learned all the cognitive skills and hypnotic skills that you are practicing right now. Your mind is able to note your thoughts and evaluate them quickly, easily, and automatically, and adjust them for you as needed. So you can feel more comfortable physically and emotionally. You are able, whenever you wish, to enter the state of relaxation. Your symptoms, they do not bother you at all. You can see yourself in your mind's eye, feeling so good, actually see yourself so relaxed, able to manage symptoms, any symptoms, comfortably and easily. The part of you that is you is able to focus on and enjoy things that really matter. You are no longer surprised at your abilities to manage your thoughts and symptoms. Your skills in this area are now second nature. You see yourself as confident. You can actually see yourself smiling, feeling so good, relaxed, happy, calm, and strong. And now you can see yourself, you can experience yourself moving to the body. You become yourself in the future. You can feel, actually feel what is like to feel so good, so confident. Before you saw yourself smiling, and now you can feel yourself smiling, so relaxed, so strong, and in control. You are feeling even better. And as you experience this future that feels so good, you are thinking about yourself. And you feel relaxed, calm, comfortable. Take a few minutes right now. Pay attention to these thoughts. And now you can ready to travel back from the future. Perhaps walking back in the tunnel. Stepping again in your time machine as you come back. Bring with you all these positive experiences of joy, comfort, delight, accomplishment, skills, and thoughts. Bring them as gifts. gifts from yourself to the future. Allow them to stay with you. They are now part of you. Now today, you have arrived to the present, enjoying and noticing. And these gifts are really part of you, new skills and thoughts, the part of you now in the present. You can carry them into the future. Be there for some time. In a moment, I will count 1, 2, 3. At the count of 3, you can open your eyes. 1, you are becoming aware of yourself. 2, all the energies from the other direction coming towards you. 3, you can slowly open your eyes. You are more refreshed, recharged, better than before. Thank you. Welcome back.
Thank you, Guna.
Thank you, Guna.
In fact, Madam should not say thank you to me, Madam. Yes, sir.
Thank you, sir.
Thank you, ma'am. I am done with my part.
Fantastic session, sir. Very nice session.
Thank you, ma'am.
Thank you, sir.
Let me ask you a question.
Yes, sir.
Is it more, see now, I do Zen meditation. So there we sit straight and the back should be totally, etc. And that also gets you into a kind of relaxation.
Yes, sir. Yes,
So
sir.
how
Yes, sir.
important is posture? A particular posture like your backbone being straight.
Yes, sir.
Or you can just lounge.
No, for meditation, you need to sit straight. And for relaxation, you can relax your
You can
whole body.
relax in any posture, leg
Any
even
posture.
crossed and all.
Yes. For relaxation, your body should be completely relaxed.
Okay.
But sitting straight has got a different meaning.
Okay.
Yes, sir.
Suresh, you can go ahead.
Good evening, sir.
Good evening, sir. Please.
It was a fantastic session today. Initially, ஒரு சின்ன theory session மாதிரி போச்சு. But the theory session was very useful for us to understand actually what is this pain management through hypnosis. It was very useful, and the demo session was also very relaxing for us to follow. And now this mass relaxation, it was awesome.
Thank you, sir.
For us. Thank you so much. Thank you so much for doing it for all of us here. Thank you, sir.
But in fact, உண்மையை சொல்லணும்னா எனக்கு ரொம்ப பிடிச்ச தனாத நான் செஞ்சேன். I learned all these things because I like the most. I really enjoy doing it, learning this. I enjoy reading this. I really enjoy this because I am all the way traveling from Dharmapuri to Chennai to attend classes, to attend TASC meeting, to attend a hypnotic circle meeting, and everything. Even now I am traveling. Just if I see an invitation, if it matches my time, then I never bother to travel. Thanks a lot for providing an opportunity. I really thank Hindu madam, and
we are very thankful to hear your passion through Zoom.
Yes, sir. Yes, sir.
If possible, let's meet in person also.
Sure, sir. Welcome, sir. Welcome, sir.
The mass relaxation was the icing on the cake.
Yes. That was a beautiful culmination of what you had started explaining in theory, and then to witness the demonstration, and this gave a wonderful closure. Thank you. Thank you, Guna, sir.
Thank you, ma'am. Thank you. Thank you, ma'am.
Yeah.
Thank you so much, and bye to all.
Thank you, ma'am. Thank you.
Yeah.
Thank you, Guna, sir. Thank you, Sumadhi, ma'am. Thank you, Surya, sir.
Yeah, thank you. It's a pleasure.
Thank you, Surya, sir.
Thank you, sir. Thank you, Surya Kumar, sir. Thank you, Surya, sir, for this nice opportunity.
Yeah. So just a word to all our members here. Next month, usually we have our meetings on the third Friday without any departure. Next month being Pongal, I'm just wondering
No,
if there
it's
is a
not
change, we
Pongal.
will.
No, third week is fine.
Okay.
Date I checked. It's after
Then,
Pongal only.
okay, then we will go ahead with the regular date.
Yeah. Okay, good night then.
Good night.
Bye-bye.
Thank you very much,
Good
ma'am,
night, everybody.
Sumati ma'am and Narayan sir, for I am really delighted to see you, ma'am. Thank you so much, madam. Thank you, ma'am. Thank you, sir. Thank you, everyone.
Yeah, bye-bye.
Thank you.
Thank you. Bye.
Bye. Bye.
Thank you, everyone.
Thank you so much.
Yeah.
Thank you.
Yeah.
Bye,
Good night.
everyone.
Yeah.
Thank you, sir. Bye. Seriously, thank you for organizing this wonderful session.
Yeah, it's our pleasure. Like.
Thank you.
Okay, sir. I'll end the session now.
Yeah, Suresh, you have taken bank details and you've got everything.
No, I think Indu will be providing me. Sir, if you
Indu
can.
is there or she left?
No, just now I think she left. Guna sir, can you provide your GPA number or bank account number to Indu? We'll do the necessary.
I think he's also left, I think.
Yeah.
No problem. Suresh,
Right, sir. We'll get it
we'll
through.
catch up.
Yeah, okay,
Yeah.
sir. Bye.
Yeah, bye. Good night. Yeah.